All right. Hello, friends. I'm just going to double check a couple things, make sure we're live in the right places. Welcome to Wellness Wednesday. So hop on, give me a hello when you get there. It looks like I see Jen on. Say hello, give me a wave. Let me know where you're at tonight. Do you have kids in bed? Do you, like me, have some in bed and have some being really loud in the other room? Possibly. All right, I'm gonna share this. Let's see. All right. Gotta make sure all of my people are on here who've been waiting. Great. Okay, I am gonna try my best. There we go. I'm gonna try my best to watch the comments. So I will go back here in a second if we need to. For now, hello, welcome to Wellness Wednesday. We are talking tonight about using oils during pregnancy, during your birth, as well as on yourself and baby postpartum. Okay, so I do have a PowerPoint because this is how I roll. It is easier for me to follow along when I have a PowerPoint going and not get distracted. That's always a win as well. I definitely can get distracted when we're talking about things that I am passionate about, and pregnancy, birth, and babies is definitely one of those things. I was a doula for 5 years and I taught childbirth education classes. I love talking about this topic because this is really what gave me my big kind of open door into natural things. This is what really got me on board with natural things because I was pregnant and I wanted an option. I wanted to know, what I could use for certain things. I wanted to know what I could use since I couldn't take medications. We were already kind of beginning to take some natural steps in our family, but I really needed some options. I would have either morning sickness, or I'd have digestive issues, or I'd have aches and pains. I had a lot of back issues, surprisingly, I'm sure that you can imagine. I had carried 7 babies and birthed 7 babies. That's a lot of strain on your hips and your pelvis and your low back. And I found some major relief during pregnancy for several things. So you guys ready? We're going to talk through this, and I'm going to try and stay pretty brief. But again, we're going to do our best. And this is being recorded and it will stay live on both of these pages that I am live on. So here we go. Oh, the spinning wheel. Here we go. So here's what we're going to talk about tonight. We're going to talk about safety and purity. That's a big deal when we're talking about essential oils and pregnancy. You don't want to use every oil when you're pregnant, right? We're only talking doTERRA here, and I'll tell you why. Along those lines, we're going to talk about oils to avoid during pregnancy. Then we're going to talk about oils to definitely use during pregnancy. We're going to talk about your birth bag. I can't tell you how many mamas reach out to me, first of all, asking what oils are safe, and second of all, asking what oils they should take to their birth. It's about more than just throwing some oils in your bag. So then we're going to talk about what oils you should be using or can be using during your labor. Then we're going to talk about postpartum healing, immediate oil usage right after baby's born. And we're going to talk about oils for breastfeeding and oils for newborns. So you guys ready? Here we go. First, I want you to know that a lot of great information can be found with this book. You can grab it on Amazon. You can go to the Stephanie Fritz website. But Essential Oils for Pregnancy, Birth, and Babies, the second edition, is going to have all the updated protocols in it. Stephanie Fritz is a midwife. and she is known as the Essential Midwife. She also has a Facebook page to that name, the Essential Midwife, sorry, where you can go for recipes. She's been posting a lot lately with the new oils and utilizing those. So I definitely would encourage you to grab this book. If you get it on a Kindle, it's $10, super cheap. I want to say it's like 18 or 19 to get the actual book. So not super pricey. And then you can head over to the Facebook page too and get a lot of great information there. Okay, so are oils safe during pregnancy? The answer is yes. 1,000 times yes. Here's what, whoopsies, sorry, I bumped my desk here. Here's what I need you to remember. When I am referring to oils being safe, I am referring to doTERRA oils being safe. Here's why. doTERRA oils are certified pure therapeutic grade. That tells us that there are no fillers, no synthetics, there are no chemicals, there are no substitutes, there are no yucky things that have fallen in from the batch or from another warehouse or whatever. You guys, these are above the industry standard. You cannot get another brand, okay, and expect it to be as good as doTERRA. If you are using a product during pregnancy on your babies, in your home where you breathe, you want those products, those essential oils, to be the best. You don't want to compromise your health, because when we compromise our health by using cheap or fake essential oils, which I will tell you, every other brand is giving us synthetic markers in some way, shape, or form, okay? When you are utilizing those, you are compromising your health. When you are pregnant, that is even more of a concern, because you have a developing child inside of you. So if something is a hormone disruptor or an endocrine disruptor for you, which all synthetics are, that is going to cause a problem for your developing baby whose endocrine system is developing inside of you. So please keep that in mind when using oils during your pregnancy. The other reason for us wanting to only use doTERRA, first of all, their sourcing is going to be better. That leads into, a higher quality plant is going to give us a higher quality essential oil. They are testing these oils, again, above industry standard. So we know what is in every batch. Not only do we know, but we can go to the bottom of a bottle of oil, look up the batch number, and we can see the testing results. Now, you might not know how to read them as a normal human being, but it's there and it's transparency, okay? There's research that doTERRA is constantly doing on their oils. You can go to source2you.com. You can see all of the testing procedures. You can find out where oils are sourced, how they're sourced, all the things that go into it, how doTERRA is crossing into the medical community now, how doTERRA's oils are now being considered the most tested, most trusted. And that is how we know and why we can use these oils during pregnancy. Now we're going to be wise. We're going to always dilute with a fractionated coconut oil. You see the picture right there? We're always diluting on pregnant mamas, fresh postpartum mamas, new babies, kids. We are diluting. What that means is we're either purchasing our oils in a pre-made roller from doTERRA called their Touch line, where it's already mixed up for you, or we're putting a little bit of a puddle of the fractionated coconut oil and dropping oils into our hand before using. We can also mix up our own rollers, things like that. The key being we're diluting them, okay? We're slowing down that the process in which our bodies metabolize the oils. So they're taking their time to work through our system, no overloads. We're also avoiding skin sensitivities, guys. When we're pregnant, our skin can be so sensitive. So we want to make sure that we're doing things that are safe and wise, and we're using common sense. So while we're talking about safety, we're going to talk about oils to avoid during pregnancy, and I will tell you exactly why. Okay, we're going to avoid clary sage and jasmine. both of which can encourage contractions. Now, here's why we're avoiding them, because you do not want to be having contractions in your first or second trimester, do you? At least not productive ones. We don't want to be having any pre-labor happening too soon, because these oils can stimulate the uterus, stimulate uterine contractions. We want to hold off and only use them during labor. You're going to see these oils pop up later when we talk about oils to use in labor, because they're going to, again, support healthy, consistent contractions. But before it's time, we just want to steer clear. Now, and there, if you read the Stephanie Fritz book, she's going to suggest that you could go ahead and use Clary-Calm. I'm going to tell a first-time mama, sure, better safe than sorry. Okay, avoid Clary-Calm. It does have minimal amounts of clary sage in it, but it has it in there. So we want to just be cautious, right? So I typically advise my doula clients, friends, customers through doTERRA. I am advising that you hang tight on Clary-Calm until later. You could start using it like your third trimester if you haven't had any signs of early labor or something like that. If you really, really felt like you needed that hormone mood stabilization, but most mamas are just going to hang tight until after baby is born. Okay. All right. Here's some oils for you to reach for during pregnancy. Now, there's no way for me to mention everything. And what I want you to keep in mind is that you can use the same oils in pregnancy that you do in normal life when you're not pregnant. So if you have occasional heartburn, you can take Digestin and run it on your sternum. If you're having muscle aches, you could take your Deep Blue and massage that on. There are lots of opportunities to use our oils just like we would in regular life. Okay, we're just diluting. We're just making sure we're diluting and we're using safety and just wisdom, right? So here are some specific things that pop up a lot of times in pregnancy that I've highlighted here for us. Okay, the first is head tension. A lot of mamas find that as they're getting these hormone spikes in the beginning of pregnancy, they get a lot of headaches. Lavender, peppermint, and frankincense. Some people like to combine them. Some people, this is how I used it. I did a little fractionated coconut oil, 1 drop of lavender, 1 drop of peppermint. I would rub my hands together, apply on the back of my neck. I would take the little bit that was on my fingers beforehand. I would do my temples, right? We're getting back of the neck, temples. And then I would do a drop of frankincense either under my tongue or on the roof of my mouth. All right. This would open up everything in my head. This would relieve any tension, any anxiousness, and it would bring some relief to the discomfort that I was experiencing. Another big complaint from moms is you can't take your allergy meds during pregnancy, right? So if you are someone who really struggles with seasonal allergies, this can be a big problem. Lemon, lavender, and peppermint is a great, effective, safe option for you, okay? When using them, you can either mix them up into a roller with some fractionated coconut oil. And if you're going to do that, you're going to run temple to temple, back of the neck. And if you really are having a lot of sinus stuff, you can kind of do little like circles around your eyes with it. Okay. You could also take a Tri-Ease capsule. Okay, so some people really need that internal usage. So this is like going to be comparable to what you were taking before, except for this is not going to have any side effects or any thing like that, right? So this is going to be totally safe for you to use. I am checking real fast because I thought I saw a comment pop up, and I want to make sure that I'm not missing anything. Make sure you're posting your, just checking. I see comments. Hold on. Okay, cool. So morning sickness. This is a big one. And guys, I am not here to tell you that the intense, if you have HG, if you have any of those intense morning sickness conditions, okay, Oils aren't going to solve that. That is like a legit concern, okay? However, the standard typical morning sickness, or as many of us know, all day sickness, um, it often can be helped with oils. So the first thing I'm going to tell you though, coming from a birth educator and doula, is make sure you're not avoiding food. Make sure you're getting small amounts of food with some protein in it. That's going to help significantly as your hormone levels are spiking. You want to make sure that your blood sugar is stable and that you're getting lots of protein in there so that you are able to support your own body as well as the growing baby inside of you. Okay, so oils to use: ginger and peppermint. Now, some moms smells are a lot, okay? So you can put them on your wrist, you can put them on the bottom of your feet, you can put it on the back of your neck. But again, if smells are an issue, you could also just, I like the bottom of the feet a lot, but you could also do like under your shirt, right? And put so that it's covered, so it's not open. Or I know a lot of moms will like do it on their wrist and then they'll just pull a sleeve over for a little while, and it does help. The smell alone will help, but the oils topically will help as well. So if you're really, really struggling with the smell of either of those, you can cover it. Again, the smell, just smelling those can be really beneficial, but the oils themselves will settle that nausea as well. The new ginger drops from doTERRA, I am learning, are amazing for pregnant mamas who are experiencing all of those morning sickness feelings. I actually have a friend who was just raving about them. She was saying that anytime it would happen and she'd be at work or whatever, and she would not really be able to like just lay down and chill. You know how it is when you're feeling like that, you just want to lay there, like just don't move. It's going to pass. It's going to be fine. And she said that she would just suck on those ginger drops over and over and over, and it was extremely helpful for her. Another complaint we get a lot in pregnancy is energy and focus. You're so tired in the beginning. That's how I always knew I was pregnant, is I would just constantly nap. I get really hungry and I just like feel the need to take naps all the time. So to help with energy, to help with keeping you awake and alert, peppermint and wild orange is going to be great. Again, I have to wear my birth educator hat for a second and tell you it's also good to rest. It's also good to get sleep. That is beneficial as your body is doing really hard work. But you know, we can't be falling asleep while we're driving or while we're at work or taking care of little ones. So here's some oils to help. Okay, anxiousness and stress. Now this is like my magic roller blend, guys. I want to tell you, this one is just magic. I'm going to refer to it several times tonight. Adaptive plus balance, frankincense, serenity, copaiba, wild orange. That is 6 oils, but let me tell you what these 6 oils in a roller topped with FCO are going to do for you. Now I will tell you, I use about, is that right? 6, no, 8 drops of each. I use 8 drops of each, okay? For me, as a normal, not pregnant person, okay? So you could scale it down to about 6 and still be in a good range. Top it with FCO, okay? That fractionated coconut oil in a roller. So this is going to be good for anxiousness, overwhelm, up and down emotions, stress. It's like liquid Xanax times 10. It is powerful and it smells delightful. Okay. You're going to roll this on your wrists, behind your ears, neck, over your heart. Okay. You're going to take deep breaths. You can diffuse any combo of these oils. You can, if you want to just make like a roller of it to take with you, you can. But if you want to make it into a spray and spritz it in your room, or you want to make it whatever, they're good oils and they're going to help with all the feels. Okay. Aches and discomfort, copaiba and deep blue rub on the area of concern. Achy feet, achy back, you get the drill. Blood sugar balancing. Slim and Sassy and grapefruit are great for that. You can use them topically. You could put a drop of each into your water. These are going to be good for mamas who are struggling with that blood sugar balancing. All right. And then my most favorite option is utilizing doTERRA's Lifelong Vitality supplements as your prenatal vitamin. I take these all the time now. I took these all the time pregnant. I took these all the time breastfeeding. They are 100% safe. They contain the exact things we need, like folate instead of folic acid, all the ideal vitamins and minerals and nutrients, and they're going to help you and baby. Like, this is going to be beneficial for everyone. This is going to fill in the gaps in your diet so that you are getting everything you need. It's going to give you really great omegas for your brain health, for baby's brain health. It's going to be awesome. You're going to love it. You're going to have more energy. You're going to feel more on top of things. You're going to have less aches and pains. It's beautiful. I cannot speak highly enough. And I can tell you a lot of really close to miraculous stories utilizing these supplements. Okay. I can tell you without these supplements, I would not have my 7th baby. And I would not have been able to breastfeed her for almost 3 years. These supplements have practically saved my life. And so I rave about them because they are so amazing. If you have any other questions about that, those of you that are in Oilers watching this tonight, you guys know I love my Lifelong Vitality supplements. And so if you are watching and you are not in Oilers and you would like to know more about why I love it, I'll have to go live sometime and share some stories. All right. We'll be sure to do that soon. All right. Here comes Courtney. I'm packing my birth bag. My due date is like tomorrow. Or for the type A moms, I am 36 weeks and my checklist says I should have my birth bag packed now. Or if you're like me and you're like, nope, not ready for a baby, not going to pack the bag, because when I pack the bag, then something's going to happen. So here's the oils that I suggest you have. Now, please add, I should have had on here fractionated coconut oil if you're choosing to use these topically. Lavender, peppermint, clary sage, jasmine, myrrh, balance, serenity, black pepper, deep blue rub, frankincense, geranium, and lemon. Okay, so let's talk about how we are going to use these. I'm going to go a couple at a time here. Now, I should mention lavender is in there. Let me go back real fast. Lavender is in there because we should just always have lavender. Okay, whether it is for calming, whether it is for a baby who's struggling to transition to life outside of mama, lavender is just always a really great one to throw in there. Okay, so first one we're going to talk about outside of lavender is peppermint. So here are the great uses for peppermint during and right after labor. Place a drop in the bedpan. If you're beginning to feel nauseous, especially in transition, a lot of moms start to get that like nauseous feeling. They're positive they're going to throw up, right? You can put, and you know, if you're in a hospital setting, they're going to go grab you a bedpan right away. Those little mauvey pink colored bedpans. Put a drop of peppermint into that bedpan. Same concept with if you're using a bowl or something like that, right? Put a drop of peppermint. Now, if you're not feeling that kind of nauseous, you're just like having these waves of nausea during labor, you can put a drop on the shirt of your doula or your birthing partner, or put it on a cotton ball to smell. And basically, if you're getting like real tired or nauseous, it's going to help settle those feelings, keep you alert. You can also, this is a really fun tip, you could also put 2 to 3 drops into the toilet. You know how after you have a baby, they're always like, you need to go urinate now. We need to see that everything's working again. You can put 2 to 3 drops in the toilet before you have a seat to open up vasculature, and it's going to help release that. It's going to help relax and open so that it helps mom to urinate post-baby, and then you can get things like your IVs out and all of that. Like those are usually like, they want to see you can walk across the room real well and not be lightheaded, and they want to see that you can pee. So here we are. All right, clary sage and myrrh. Clary sage and myrrh are really effective at bringing on more consistent contractions. Jasmine is also helpful for increasing and making contractions a little more worthwhile. But specifically this combo rubbed on the abdomen or insides of ankles will bring about those more consistent contractions, especially if, guys, we see this a lot between transition and feeling that urge to push. This can be kind of a little pausing place. Now, on one hand, it's really good. It's helping everything to open and helping baby to sink nice and low into the pelvis. But sometimes this can be an emotional or a mental block. Sometimes mom can be really tired and those hormones are slowing down a little bit and we need to give it a little bit of encouragement. Take advantage of those slowing down periods, close your eyes, rest between contractions, but also I would highly advise putting a drop of each of these on the insides of your ankles, rub it on your belly with a little fractionated coconut oil, and you're gonna see those contractions get a little more consistent, pick up, and a lot of times we find mom has an urge to push pretty quick. Oh, and I spelled it wrong, but we're gonna ignore it. I can't believe that autocorrect didn't catch it. Jasmine can be applied to the abdomen in this lovely touch roller already diluted for you to alleviate the discomforts from contractions. You guys, it is not comfortable, right? It's also great for emotions during labor. So it's going to be calming to mama. It's going to be calming to the, not stopping contractions, it's encouraging contractions, but it's really effective at calming the sensations so that you can take deep breaths and get on top of them. Okay, really, really important that you're being able to remain calm and breathe through those contractions. And when we're all worried and we're having discomfort, sometimes we don't breathe past the pain, right? We get to the pain and we're like, that feeling. We need to just be able to breathe past the discomfort that we're experiencing. So applying jasmine to your hands and rubbing on your tummy during a contraction can be a really soothing, calming experience. Balance and serenity. Boys and girls, let me tell you. Now, if you do not love the smell of serenity, you can use just balance. But I will tell you, this is the one oil that I find nobody really hates during labor. There are some like strong lavender smells, which if you don't love lavender, you might really pick up on that in serenity, and that's fine. But one or both of these, whichever your preference, you can diffuse it in the birthing room. Let me give you a little word of caution on diffusing though. Balance and serenity are really the only ones I ever suggest getting a diffuser, because what happens is it gets in the air, and because essential oils break the water and the oils into microparticles, they stay suspended in the air for a really long period of time. And that means if you suddenly don't like a smell, you can't get it out really. It's kind of stuck in the air for a little bit and it'll linger. So when we're talking about using oils in the birthing room, if you don't love the smell of it, don't diffuse it, right? Like if you kind of like it now, but you don't typically, don't utilize it. But what I will find is putting it on a cotton ball or on a blanket or on someone else's shirt can actually be a really great option, because then you can, you know, maybe not on a shirt, but if you want to put it on like a little piece of like cotton on their shirt or something like that. You can also use aromatherapy jewelry, like if you have a bracelet and you want to smell the bracelet, or you want to put it on the cotton ball to smell the cotton ball and then throw it in the trash. That can be a really great option. But these two oils are going to bring peace and calming to that birthing room. They're going to promote slower breathing and relaxation, both during and between those birthing waves, so mom can rest and relax between, and she can breathe slowly during those contractions and just breathe all of that away. Okay, this is one of my favorite pictures because those are my hands on one of my very special clients' backs. She was experiencing a lot of back labor. If you've ever experienced that, you know it is intense. Sometimes it's just, there's a lot of pressure because, you know, there's a human exiting from your body. So I like to apply I like to use Deep Blue Rub as the carrier for that black pepper. So I will squirt a little Deep Blue Rub, usually about a pea-sized amount. Then I'll put the black pepper, a drop of that on top, and I'll massage it in really good. You can apply some slight pressure or use massage if mom likes that as well. But this will ease that aching pressure that is constant. It's not going to relieve the pressure down there, but it will relieve that just constant ache that sometimes is felt during back labor. Okay, let's talk about immediate oils to use post-birth. The first one is going to be frankincense. Look at that sweet baby head. Oh my gracious. So we're going to use frankincense in two ways postpartum. The first way is going to be put a little fractionated coconut oil or use a frankincense touch. So either fractionated coconut oil with a drop of frank, or use the frankincense touch and roll it around your hand. Rub your little hands together and you're going to massage that sweet new baby head. Frankincense is going to help transition baby from mama's womb to earthside. It is a difficult transition for babies. They've just done really hard work as well. And so we want to help them with that transition, and frankincense is a beautiful oil to use for that. The other use for frankincense is in combination with some other really important oils. Okay, you can either make this in a spray, or you can use the concoction like in a little 4-ounce jar and stick cotton rounds in to make your own homemade Tux pads. I like to use frankincense, lavender, helichrysum, and copaiba. All of these are really great for reducing inflammation and swelling. They're all great for pain. They're all great for excessive bleeding. So it's a really excellent combination to help with that super sensitive area of your body right after you've given birth. So you can take a few minutes, but then when you are ready to, like, those of you who've had babies, when they bring out the ice diaper and they bring in the mesh panties, this is when you want to get either your homemade Tux pads, or you're going to spray the perineal area with this awesome spray. Okay. Some mamas actually like also to use, if they don't want to mix something up like this, you can empty the contents of Immortelle into a spray bottle with a little extra fractionated coconut oil and witch hazel, and you can do that. Witch hazel is, sorry, I should have mentioned that. Witch hazel is the carrier of choice that I use. I use a combo of fractionated coconut oil and witch hazel in the spray, as well as in the Tux pads. But the Immortelle also has a lot of these similar great oils in it, so that can be used as well if you just want something already made. Okay, geranium and lemon. So mama, this one's not for you. This is for baby. You can use geranium and lemon to help support liver function. And I don't know if you know this, but little tiny livers sometimes have a hard time filtering out bilirubin, which then causes jaundice. So geranium and lemon can support those little baby livers and help them to filter out the things they need to filter out. I applied this twice a day to my little ones. So like I had my babies that were born like early in the morning or at night, right? Like I would start the next day, but twice a day for the first just couple of days, and that'll just really help their little bodies to filter that stuff out. I will tell you, I had the first baby that I did this on was my 5th, and I didn't know about this until like the 2nd day. And then my darling, amazing doula and best friend Teresa came over, and she was like, "Oh, jaundice, I know what to do." And she had just started starting to use oils. And so she pulled out geranium and lemon. She brought him over to my house. We put him on his feet. And I kid you not, within 24 hours, that boy was no longer yellow. He was looking amazing. We found that then after that birth, I began taking doTERRA's Lifelong Vitality supplements. I had different birthing environments. My babies that were birthed in more gentle birthing environments didn't have as much of the trauma. They didn't have as much of the concerns. But my lifelong vitality babies, man, those were some healthy babies. That's for sure. Okay. For overwhelm, intense mood swings, you guys know the feels. We're going to reach for that magical oil blend, that same one we talked about from pregnancy. Utilize this, guys. Now, if you don't want to add adaptive to this, this is like my super powered liquid Xanax recipe that I have now been adding adaptive to for myself. If you would rather just diffuse adaptive in your room or at home when you get back home, that's totally fine as well. But know that these are some powerhouse oils for overwhelm and anxiousness, okay? And there's a lot of that in those first few days. There's a lot, especially if you're a first-time mama, there's a lot going on there. Be kind to yourself. Eat healthy, whole, nourishing foods. You don't have to let everyone and their dog come hold your baby and you have to entertain them and host them. It's okay to say, we're going to rest, and you should. Okay. There's no need to have unnecessary drama or stress when you have just done the most incredible thing you will ever do by birthing a human being. Okay. And growing a human being. And I don't care how you birth that baby. Okay. Oh gosh, I didn't mention something really important. Hold on, it's going back. This also can be used on cesarean scars. So you can utilize this. Some moms put it right on over, like just surrounding the stitch area until those dissolve, right? If you want to wait until afterwards and then start applying, you can as well, but that is a great option. That same combo, if you put it in a roller and want to roll it around near the stitches, you can, but over that incision area is going to be a really great spot to use your frankincense and your helichrysum and your lavender and copaiba. Going to reduce inflammation. They're going to encourage healing. They're going to help with any discomfort or itching or anything like that. Okay, had to say it, guys. I can't leave that one out. Very, very important. The other thing to keep in mind utilizing this is, you're going to have moments afterward where, you're nursing a baby and you're starting to have those after birth cramps. Guys, if you have more than a couple babies, it's intense. And I know for me personally, I had to really utilize this for that kind of situation to keep myself calm for baby, to keep myself calm. So, okay, a baby that has a mom who can't hardly breathe because she's having afterbirth contractions and she's got a newborn baby trying to latch onto her nipple, like that's not a calm baby who wants to latch, right? So I had to really find that I had to calm myself, not because I was feeling overwhelmed, but because the situation I was in required me to need to be chill. Speaking of afterbirth, I loved lavender, copaiba, and I didn't have copaiba, wish I would have. Lavender, copaiba, and Siberian fir on my tummy for those afterbirth cramps. Okay. All right. Now we can move on. Oils for breastfeeding. I just mentioned our magic roller blend for calming, encouraging deep breaths when latching, and to help you relax for letdown. Copaiba specifically has been found to increase milk supply and to help with that letdown. Okay, so we want to be using that combo because it has the copaiba in it, has all the calming things, and it's going to just, you have to be relaxed for that milk to release. Okay, so let that happen. Sore or blistered nipples, guys, I do not want to terrify anyone or scare anyone, but it happens. So Correctex is actually really fantastic. I would apply after baby was done nursing, and it's absorbed into the skin by the time the next feeding came around. It was a perfect option. If it's just soreness, you can use just lavender. I used a lavender touch roller. I would just put it on my finger and apply on, and then just go about my business, and then it would be all absorbed by the time the next feeding rolled around. If you're concerned about baby tasting that or anything like that, you could grab a little FCO and just wipe the area off with that, as that will dilute it far enough to actually remove the essential oil from the nipple. I haven't had anybody have a concern there or an issue there. And then if you find that, you know, a couple weeks down the road or a month down the road or a year down the road, whatever, you're needing a little boost in your supply. Obviously, we know that like nursing frequently, nursing and then pumping right after, these are all ways to increase your supply. But you can do a 24-hour little milk boost if you would like to. And basically that involves after every time baby nurses, you take basil and fennel with fractionated coconut oil and you massage from the outside to the inside, both breasts, you do both sides, and you massage toward the nipple from the lymph nodes all the way to the nipple. You do this after every feeding around the clock for 24 hours. Call it a day and you'll find a nice little increase. Just a little boost. It's nothing crazy, just a little boost. Now I want to talk briefly about breastfeeding safety and reminders. We want to avoid peppermint internally when we are breastfeeding, and we want to avoid peppermint topically for the first 4 months. The reason being, breast milk supply is established at 4 months. So we want to not do anything to mess with that. What it is that peppermint for some moms may cause them to have a temporary dip in supply. In those first 4 months, we don't want to really mess with supply. We want to keep things boosted and happy. We want to be eating lactation cookies and taking our supplements and really just staying chill and calm and working through those early breastfeeding days, okay? But once we get past 4 months, let's say we've got allergies or head tension or whatever, then we can begin to reintroduce peppermint in small doses if you want to. You do not have to, but for those who are like, this is the only thing that helps my headache, I'm going to say if you're past 4 months, let's dilute really well and give it a try topically, okay? Now keep in mind, any of the blends with peppermint are typically fine. There are such minuscule amounts of peppermint in those blends that it is not a concern that we know, okay? You want to also, in those early days, avoid putting oils straight on your chest. Now, keep in mind, I did just tell you what to do for a boost down the road. And keep in mind, I did just tell you what to do for sore nipples. Unless you need something on your actual breast, chest, nipple region, I'm going to suggest that you don't use any oils there. Reason? We want baby to smell you. So much happens in that nursing relationship when they smell their mom, when they smell her milk, getting used to those pheromones and hormones and all of the yummy smells. And you should be there smelling that baby head and just soak it all up. Guys, I'm getting all goosebumpy just thinking about it. It's a magical time, okay? So we want to make sure that the things that baby smells when near you are you, right? That's what they're going to recognize. So unless we're having severe nipple issues or severe whatever, we're going to just try and keep that as naturally smelling as possible. Diffusing is a great plan when you are in those first couple of months, both learning how this goes. Diffuse things that make you happy, that make you calm, okay? I can't tell you even, when I smell lavender, because what I would do is I had a little one who she would get so worked up. She'd get so excited and then frustrated because it wasn't happening fast enough and she's learning and I'm learning, and she had a lip tie and a tongue tie. And we had so many struggles in the first couple of weeks. And that was my 7th baby, right? I knew what was going on, but we had to learn it together. And so I used lavender touch on the bottoms of her feet while we would, right before we would start nursing, we'd change her diaper. I put lavender touch on her feet and I'd zip up her little onesie, or I'd wrap up her little body, or I'd lay her on me skin to skin, whatever we were doing. And we would utilize that lavender touch to help keep her calm and relaxed while we were beginning the latch, right? I smell lavender now and it smells like postpartum. And in a good way, it smells like my new sweet baby. I needed oils in the diffuser that were calming and were happy. I used a lot of balance. So while she's a typical 3-year-old now, that was the most chill, relaxed, happy baby you've ever seen. So diffusing is a great option in those early months, just while you guys are learning the breastfeeding process, whatever it takes to help you both be calm and confident and relaxed during all those feedings. Oh, that says something weird at the top. Sorry about that. Okay, now we're going to talk about oils for newborns. I've made a list here, but what I want to keep in mind is if your baby needs an oil, you can use it, just dilute it. All right. These are our most gentle oils for our little ones. So frankincense, you can get it again in the oil and dilute it, or you can buy the Touchline. Lavender, digestion for crabby, colicky, gassy babies. I like to rub that and lavender on the bottoms of their feet if they're struggling with that. Cardamom is great for respiratory stuff if you find that they're getting a little stuffy. It's also great for digestive stuff. So you can put it on the bottoms of their feet, on their little chest, or on their little tummy with some coconut oil. The doTERRA Kids line is beautiful and amazing and perfectly formulated for even the littlest ones in our life, okay? So steady or calmer. You could use stronger if you're going to be going out to doctor's appointment or going to see big brother or big sister at school or something like that. You could use that on babies' feet for their immune system. The doTERRA Touchline is going to be great, like I mentioned, because it has pre-diluted oils all ready to go. So I've already mentioned it, but the digestion, the lavender, and the frankincense, I bought those in the Touch oils, and those were they were in our diaper bag always. They were on my nightstand always. And then the baby line. If you're not familiar with the doTERRA baby line, there's a body wash and there's a diaper cream, and they're magic, and you should get them. Easy enough, right? Okay, so that is the end. We've talked about pregnancy, we've talked about birth, we've talked about babies and breastfeeding and all the magic that entails. I'm checking our comments. It doesn't look like anybody had any major questions, so that's cool. Awesome. I'm going to double check my other spot for comments. Yeah. Oh, here we go. Sorry, I'm seeing another comment. Are we rubbing oils on NEAT or, oh yeah. So Katie, we're doing all of this with a little bit of fractionated coconut oil. So that's what we're gonna dilute with. Okay, cool. Well, awesome, guys. It's been really lovely to hang with you and talk about one of my favorite topics. For those of you who have not already followed our page here, Michael and Courtney Owens, be on the lookout. I've been feeling a little sad because I haven't been getting to stretch my doula muscles so much these days since I retired last summer. And so I'm going to be doing some birth and baby posts on Thursdays. I'm going to be doing live videos on Thursdays and just bringing that piece of my heart and my passion to the table. So I would love for you to tune in. If you haven't already liked the page, go ahead and do that so you get notifications. And yeah. Anyway, I hope you guys have a great night. Elevation Oilers, thanks for letting me share this with everybody else. It's nice every once in a while to share a fun topic. For those of you who are not already in our Oilers group, it just takes grabbing your own kit or your own membership, and you can be a part of that with us on our team. So we do this every single Wednesday at 9 o'clock. Oilers, next week, we're going to talk about men's health. My specific title, just so you know, is Men's Health, More Than Just Beards, Balls, and Barbecue. It's going to be good. Michael and I are going to do it together, which should be awkward and exciting and wonderful all at the same time. All right. Have a good night, and I'll see you guys soon. Bye.